The cost of not caring. How cutting healthcare spending affects public health. Welcome to our deep dive into the hidden costs of cutting healthcare spending. It's a topic that, frankly, sounds about as much fun as a root canal performed by a drunk badger. But stick with me, because neglecting our health to save money is like setting fire to your pants to stay warm. Sure, you might save on heating bills in the short term, but eventually you're going to have a much bigger problem on your hands. Today, we'll explore how these cuts impact public health, from preventive care to economic productivity, and how the supposed savings end up costing us all more in the long run. Let's get started. The illusion of savings. How cutting preventive care costs us more. Let's talk about preventative care, shall we? That's the boring, sensible stuff that keeps us from needing expensive interventions later on, like regular checkups, screenings, and vaccinations. Think of it like this. You wouldn't drive your car for 10 years without an oil change, would you? You'd end up with a smoking heap of metal that costs a fortune to fix or replace. So, why do we treat our bodies like disposable lighters when it comes to healthcare? The logic seems to be that if we just ignore potential health problems, maybe they'll just go away. Spoiler alert, they rarely do. Now, some folks will argue that cutting preventative care saves money. And on paper, in the short term, they're technically not wrong. But that's like saying you saved money by cancelling your car insurance right before you crashed into a lamppost. It's a very narrow and ultimately very stupid definition of savings. Because here's the thing, every 10% decrease in spending on preventative care can lead to a 6% increase in chronic disease incidence. That's right, folks. We're talking about heart disease, diabetes, cancer, the real crowd pleasers. And treating those chronic conditions, oh, that's where the real fun begins. Because without preventative care, those manageable problems become expensive nightmares. We're talking about a lifetime of medications, specialist visits, and potentially even surgery. Suddenly, that cheap decision to cut back on preventative care looks about as financially savvy as investing your life savings in Beanie Babies. From bad to worse. How cutting healthcare overloads emergency rooms. Cutting preventative care is like playing Jenga with your health. Eventually, the whole thing comes crashing down. When people can't get basic care, they wait until it's a 5-alarm fire and head to the emergency room. Emergency rooms are amazing but incredibly expensive. Treating a heart attack in the ER is pricier than managing high blood pressure with regular checkups. Cuts in public health funding led to a 15% increase in emergency room visits. It's a vicious cycle of neglect and escalating costs. Chapter 3. The High Price of Neglect. How cutting healthcare impacts public health outcomes. Now, I know what you're thinking. John, this is all very depressing. Can't you at least pretend to be a charming British man for a few minutes and tell us a whimsical story about a talking penguin? And while I'd love to, the reality is far less adorable and far more alarming. Because here's the thing, when you cut healthcare spending, people get sicker. And when people get sicker, they die sooner. It's a simple equation, really, but one that seems to elude those who hold the purse strings of our healthcare system. Don't just take my word for it, though. The American Journal of Public Health published a study that found states with reduced public health budgets experienced a 10% increase in mortality rates over a decade. That's right, a 10% increase in people shuffling off this mortal coil prematurely, all because some bean counters decided that human lives were an acceptable line item to cut. And as with most things in life, the burden of these cuts falls disproportionately on those who are already struggling. Low-income and minority communities, who often face systemic barriers to healthcare access, are hit the hardest by reductions in public health spending. It's like taking a leaky boat, drilling a few more holes in the bottom, and then handing the life jackets to the first-class passengers. Take, for instance, the impact of reduced spending on maternal and child health services. These cuts have been linked to higher infant mortality rates, particularly in communities of colour. Chapter 4. The Ripple Effect. How poor public health drags down the economy. Now, some of you might be thinking, John, I'm not my neighbour's keeper. Why should I care about their health? As long as I'm healthy, that's all that matters. And while I applaud your rugged individualism, the truth is, your health is inextricably linked to the health of your community, your city, your country, and indeed, the entire world. We're all in this petri dish together, folks. See, when people are healthy, they're more productive. They go to work, they pay taxes, they contribute to the economy. They buy artisanal cheeses and overpriced lattes. They keep the wheels of commerce turning. But when people are sick, they can't work. They rack up medical bills. They need assistance from social safety net programs. They become a drain on the economy rather than a driver of it. The World Health Organization estimates that for every $1 spent on improving health, economies can see a return of up to $4 in increased productivity. That's right, $4. You could buy a whole venti latte with that kind of return on investment. Chapter 5. The Long Con. How cutting healthcare today leads to higher costs tomorrow. Now I know what you're thinking. John, this is all very well and good, but I'm more of a live for today, worry about tomorrow when it gets here kind of person. So, what if healthcare costs more in the future? I'll be dead by then. And while I admire your devil-may-care attitude, the reality is that your short-sightedness is going to cost future generations dearly. See, cutting healthcare spending isn't like delaying a software update. It's not something you can just put off indefinitely and hope for the best. The consequences of neglect are cumulative. The longer we wait to address health problems, the bigger and more expensive they become. It's like ignoring a termite infestation. Sure, you might not see the damage right away, but eventually, your house is going to collapse. The National Academy of Sciences issued a report stating that neglecting healthcare investments could lead to an estimated 20% increase in future healthcare spending. That's right, a 20% increase. That's like adding a 20% surcharge to every doctor's visit, every hospital stay, every prescription drug. And guess who's going to be stuck footing that bill? That's right, our children and grandchildren. We're essentially handing them a credit card with a massive balance and saying, good luck with that. Outro, the true cost of care. So, there you have it. The supposed savings from cutting healthcare spending are nothing more than a mirage, a dangerous illusion that will cost us all dearly in the long run. We've seen how these cuts lead to reduced preventative care, increased emergency room visits, poorer public health outcomes, and a drag on economic productivity. We've explored how neglecting healthcare investments today will lead to higher costs tomorrow, burdening future generations with a legacy of illness and debt. It's a bleak picture, to be sure, but it's not a hopeless one. We have the power to change course, to demand a healthcare system that prioritizes prevention, equity, and long-term sustainability. It's time to stop asking, how can we afford to provide healthcare for all? And start asking, how can we afford not to?